Hi, this is my husband Dakota, who I'm going to teach about the risks and signs of substance use disorder and addiction as a future CRNA, and how he could get me help if that situation were to occur. So CRNAs work in very high stress environments where they are exposed to addictive drugs every single day and very easily. CRNAs essentially keep patients alive during surgery. So that's a very big responsibility, and that serves as a really big stress factor too. If there are other risk factors present in a person for addiction, the stressors of the job of a CRNA could lead to the development of substance use disorder. Other significant risk factors for developing substance use disorder include depression, low self-esteem, a history of risky behavior or personal history of trauma or abuse, chronic pain if someone has been used to taking addictive drugs before for their pain, and the presence of significant family and community stressors. So, substance use disorder occurs when somebody wrongfully uses substances that impair their mental functioning. Substances that are capable of being abused and potentially leading to addiction include simple things like alcohol or stronger things like opioids, benzodiazepines, and even anesthetics such as propofol. Most of these medications are used every single day for pretty much every patient that we care for, which makes access to these drugs very easy. Substance use disorder can even sometimes start with a prescription that's no longer needed, kind of like how I talked about with the chronic pain, or if somebody had a surgery and they were on opioids post-surgery, and then they kind of got addicted from that. The important thing to remember about substance use disorder is that it's not just an easy fix where the person can just make a choice to stop abusing drugs. Substance use disorder is a disease that requires proper medical and psychological treatment a lot of the time. So substance use disorder and addiction are two separate things. But addiction can result from substance use disorder. So addiction is when the person loses all sense of self-control and they can't quit using even if they know they need to and they want to. So CRNAs who suffer from substance use disorder and addiction are very dangerous to themselves and their patients. Since it impairs that mental functioning. So if a CRNA is impaired in any way, their life could be put at risk, as could every single patient that they care for. So if a CRNA is diverting drugs, drug diversion means taking it from what it's supposed to be used for a different source. So drug diversion could be like only part of a dose of a medication being pulled up in a syringe, the rest of it diverting to yourself, and then filling that syringe for the patient up with normal saline to make it look like they're getting the full dose, even though they actually aren't. So if a CRNA is diverting drugs from the patient to themselves, the patient could severely suffer and not receive that adequate pain control and sedation that they need for surgery. So they could wake up in a significant amount of pain after surgery if they're not getting the doses that they need. So the scariest thing about substance use disorder and addiction is that 1 in 10 CRNAs will suffer from some form of substance use disorder, which is why it's so important for us to talk about this and realize how serious of an issue it is, and to kind of just make us both aware of the signs of substance use disorder. So things to be on the lookout for you as the husband of a future CRNA, weird mood swings, changes in personality, either missing work frequently or picking up a lot of extra overtime. That could be staying late after work frequently, going in early for work, things like that. It could go either way. Wearing long sleeves whenever it's hot outside, difficulty concentrating or difficulty doing regular daily tasks, unusual tension between us that doesn't seem to have any other sort of source, significant weight change that could be either weight loss or weight gain, and then physical signs such as bloodshot eyes or track marks. All of these could be signs of either drug or alcohol impairment, but signs of drug diversion are often seen in the workplace, so that may not be things that you are actually able to see. But if you hear, if we're ever around colleagues or something and you hear any of them commenting on me using more drugs for my cases than most other cases require, taking frequent bathroom breaks, always volunteering to like administer my coworkers opioids for them or work their shifts for them, or my patients having uncontrolled pain after surgery, these could be signs that I am diverting drugs. So a lot of people might be afraid to report a family member they suspect is abusing drugs or alcohol, but their safety is the most important thing to remember. Because if a CRNA gets adequate treatment and they go to rehab, they could even return to work and not lose their license, which is really important. So inpatient rehab for medical, like specifically for medical professionals, is the most beneficial for this kind of disease. And along with continuous outpatient rehab afterwards, that combination works best for treating substance use disorder and addiction. So during that time, it's super important to be supportive. If you suspect any signs of a substance use disorder, to not be judgmental, because family support throughout and after treatment can help a CRNA to get sober, stay sober, and hopefully get back into practice. So if you ever suspect any signs of substance use disorder with me, there are ways that you can get help. There are resources available to make it easy for you to kind of know what to do. So the American Association of Nurse Anesthetists website has resources available, which I will show you. They have a helpline, which is available 24/7, that you can call anytime just to talk to somebody to figure out what you should do. Here is this website. It's on aana.com, and you'll go to health and wellness and then peer assistance, and it explains how you can get help for other people, i.e. me. If there's something life-threatening, obviously call 911. But if you just need to talk to somebody, you think something is going on with me, there's this hotline available to you to call. Like I said, it's available 24/7. There's also here's a wallet card for you that has the helpline number on it. And then it just gives you some little tips on the back to remember it's okay to get help, and it's most important for us to be safe. So the hotline is also confidential, so you don't have to worry about, the law getting involved or anything yet. So if you suspect anything at all, please don't hesitate to call this number, keep it with you. That way they can help guide you on what to do and get me that help that I hopefully will not, but we had to kind of talk about the risks of that and how to get help if I would ever need it. So